Dr. Salomon here. Macular degeneration is a condition where the central part of the retina, the 20/20 part of your retina that does all your seeing for detail, color, reading, recognizing faces and details, deteriorates most often with age. Macular degeneration does have a tendency to run in families. Much more rarely affects blacks than whites, but we can see this in any ethnicity, even in some younger ages. We sometimes see this in people in their 40s and 50s, but it's more common in their 60s, 70s, and 80s. We do believe that excess ultraviolet exposure, UV exposure, increases the risk of retinal damage. We do know that cigarette smoking, for sure, increases the risk of macular degeneration. We do also believe that taking antioxidant vitamins and eating correctly, in other words, the omega-3 free fatty acids, which are found in fish oil capsules or in fatty fish like salmon and mackerel and herring, and taking antioxidant vitamins, which are over-the-counter, which also include vitamins A, C, E, and zinc, and magical things called lycopene, xanthine, and lutein are components of our diets that we think help protect the retina from further damage. Once macular degeneration has occurred, depending on what type it is, we call them dry and wet, other broad categories. Some have treatments that involve laser or injections. Some, unfortunately, don't have treatment. The most important thing I can tell a macular degeneration patient is use your eyes. I've had patients tell me they stopped reading and stopped enjoying themselves. They didn't want to use up their retinas. That's ridiculous. Don't need to be holier than the retina. If you want to do something with your eyes, you will not damage them, you will not strain them, you will not hurt them in any way by using your eyes when you can. And if you have difficulty with something and you want to try, that's fine. If you cannot continue with it, that's okay too. It may give you a headache, but it will not damage your retina and it will not cause any progression of your disease. So I encourage people to use their eyes as best they can, as much as they can. That's what we're here for. That's what the eyes are there for.